Yeah. This is from Greece, 25-year-old. Spine neurological problems. Oh, myself. Hello, Dr. Morse. I am TASOS. 25-year-old, live in Greece for 11 years now, since I was 14. I have an issue with my spine. With a muscle close to the spine, gets sore, hurt. I have weird, yeah. Probably a neurological. All right, so it's affecting the nerves, but it's a lymphatic issue. And your muscles, of course, that's where you're always moving, right? Well, when you're always moving, what is the chemistry? What side of chemistry are you creating through activity? It's not alkalis. These are your electrical side. These are acids. Lactic acid. I'm creating lactic acid. Okay, am I getting rid of it? And then on top of that, you're consuming proteins, which always has an acid ash to them, high nitrogen, high phosphorus type of products. So these are all converts to acids. And then, of course, faulty digestion. Most people combine starches with proteins. So the digestive process of breaking a protein down to the polys and the peptide chains, next to none. So now you have these radical proteins going through the gut tissue, and then you got starch, which is like a glue. So you got all kinds of problems in that manner. Thank God there's malabsorption to a lot of people, I tell you. But it is a lymphatic problem. And well, wait a minute, a lymphatic problem means it's a kidney and adrenal problem. If you sweat, then it's not a thyroid problem. But if you don't sweat either, son, this is a real problem here. Remember, as the lymphatic system becomes more and more stagnant, swelling takes place. And what's the vertebrae made of? Oh, cells. Oh, and everywhere you have cells, no matter where it is, you have to have blood and lymph involvement in some way, right? You have to have energy, ATP. You have to have your food coming in, but you also, and that's no matter where it is, you have to have the waste removed out of the body, not recirculated in the body, removed out of your body. Vital, right? So when muscles swell, well, and a good thing, Ben was talking about that, how he got so much big that his muscles were so big, it shut down his nervous system. His arms were always numb. Scared the heck out of him. But that's what happens. Swelling then impedes on blood and nerve flow. So you can get ischemia easier. You see that all the time in infarctions and everything else through the body like that, whether it's a heart or anywhere else. And the same thing neurologically. And so that's why. And injury is the same way. You know, you've got inflammation from an injury. The body's trying to deal with the damaged cells, which are going to be proteins. And what if your body can't move that out? And that's when you see quads and paraplegics that don't get up after trauma. You know, you break down. And then you see compression, you see herniations of the vertebrae and stuff like this. All this, the muscles, all of this. And then you have spasticity. It's a nightmare. So number one, my friend, you've got to get your kidney. Oh, filtering. And this sounds like a broken record, and please let it be. You know, work on that. Fruit, herbs. I know people talked about dates, a lot of things. Dry fasting is probably the most profound way to get it going. But again, I'm only recommend 24 to 36 hours. And for you guys that are going out there 10 days, 14 days, that's not me. You guys are taking a risk, especially if you're really agglomerated. You know, your body gets backed up in so many of these areas, and you can see your ladies with the breast tumors and stuff, how difficult it is to open. But you got to open this up before this gets cleaned. Oh, this is your lymph. Oh, these are the septic tanks. Also, by the way, to the lungs. But then the kidneys are just hiding right back there. But you can't change this outcome without changing this outcome, and this outcome can't change without kidneys. Because without kidney filtration, how does your sewer system move? It doesn't. And that's what you see in most everybody that we're talking about. And that's how simple it is. I am not sure how I can explain. You don't have to. I've been through all kinds of things. You know, I had arthritis on my upper T-spine way back when I worked at the phone company. I was only 20 maybe, drilling and all this stuff because I'm an old farm boy, man. We threw bales of hay. It wasn't like today. So, I mean, we had Christmas trees. You talk about hard work. Holy crap. So you're always, I mean, stressing the body big time. I mean, tell you, farm work is hard when you're baling hay like that on the individual bales, getting them up in the hay mow, getting them up on the wagon. The first row or two, no big deal. They throwing a 7,500-pound bale up about 4 or 5 stories. Whew. Gets real. I am not sure how I can explain this, but when the problem gets really bad above a certain spot, my spine feels twisted and tilted to the left. Well, listen, my friend, this is how you get scoliosis. You know what? This is how your spine can twist in all kinds of ways, and not good stuff. Everything gets augmented like that in your body. Even your hands can go. Look at some of these people that model like this. And this is all just about acidosis and see you later body, see you later cells. Now, I had a case in a nursing home. This was a kind of a friend of mine had a small nursing home. Turned his house, built rooms and all kinds of stuff. And this court sent this case over to him, ALS, highly advanced ALS case. She was locked to her shoulder, and her legs were locked closed. Couldn't clean her or nothing. She'd just been that way for years, just locked down. We had this on camera. I don't know where the film is. God. But I'll cry thinking about this one. She just unfolded as beautiful as you can see. This is what the body does when you bring hydration and electricity in it. Not when you eat proteins, not when you eat like these American dietetics people who are fruitcakes. These people are nuts. These people are the least understanding of what health is all about. And they put this in your face. And then they try to come after you because you want to help people. That's why in the future, these people are going to have some serious lawsuits against them, and I'll be proud to be a part of it. And just shut these people up. You know what? They're part of the killing machine. You know, you eat like this is what kills people. You know, again, young man, we pulled out a cardiac arrest at 8 o'clock. He's eating a barbecued beef sandwich and French fries in ICU. Died that afternoon. No kidding. You killed him with your food. I mean, it's just, I mean, this antiquated medical thinking has to die out. And some of these new medical doctors, young medical doctors, I'm really proud of you guys. I was talking to this PA that's a PA of my renal surgeon. He says, yeah, I want to learn about natural health. That's what you need to help you understand why. Because there's no whys in allopathy. But naturopathy is full of whys and explaining to you how this all works. Anyway, twisted tilt to the left, and with that comes a panic attack. Yeah, you know, it's all adrenal kidney related. And you shut down those neurotransmitters, you'll go into a panic attack because it reverbs to breathing. Oh, yeah. I mean, so very important that you get on I would go 100% grapes. I'd go 100% grapes and get some kidney formulas, circulation, brain and nerve, a couple kidney formulas, get one lymphatic formula, and then go after this. And then you could use the connective tissue formula that we have, the calcium-rich formula that rebuilds connective tissue and the like, bones and things, strengthens these tissues. It is worst thing that has ever, oh no, I believe it, my friend. I believe you totally 100%. That's why I'm here 100% on your side. I also had another problem at the same time, which is I used to see everything tilted to the left. The whole view I see with my two eyes tilted to the left like a tilted screen. Yeah, well, This is the acid side of chemistry and what it can do to you. Chew you up, your physical body up, and take it back down to what? Atoms. This is an atom rearrangement. Creation just moves atoms around. You can't get new ones. Creation at this level is already completed. And you can see that if you get above that, you get into the causal world, you can see the future of this planet and what's going on. And you can see the past too if you want to go there. I wouldn't advise it. Sometimes it's not good to go back. I just have to tell you. Thankful these two problems are not permanent. They happen when the muscular spine situation gets really bad and the spine sensation lasts because you've got to move. See, and movement helps but increases the problem because every movement requires cell energy, and cell energy has its byproducts. Anytime the cell burns anything's burnt in nature, you're going to see byproducts everywhere. Burn a bunch of logs in the fireplace, what do you see coming out of the chimneys? For those that can understand that breathing of a fireplace is really toxic. Whew. I feel sorry for people in Alaska when in the winter you've got wood burning fire stoves and all this everywhere, and this goes up into the air. It's sad stuff. And then even in the cabins, and it's like, oh. When the problem first started, I visited many medical doctors, neurologists, ophthalmologists, orthopedics, one to check my ears for vertigo, but no one could help me. You know what, son? Why don't you send me a picture of your eyes? We'll have up there, Marco, you have this Dr. Morris TV question thing, but give me a picture of your eyes. Let's take a look at it, and we'll reference this, and we will look at that and see what you got going. So iridology is your first line of look. Then look at your spine, right and left. Take a look at what it looks like. Also your bowel structure at that level as well, because your colon and your small bowel relate to your spine too. So everything is connected. This is why everything is systemic. You might see it localized problem, but believe me, it's all down that one side. And you're seeing that side, pulling to that side. But we've had tons of scoliosis, severe, and I haven't seen one not get well from it. Not one that I know of. But there's always someone out there. But still, these people don't know. And you know what's sad? These are some good people at these levels. I mean, these guys have had years of study. They're trying to help people, but they don't understand the lymphatic system. It's not in the books. Little is understood medically about the lymphatic system, and we put it out there to give you almost a complete picture of it. From the job of the spleen, the job of the gallbladder, to the lipids. Why does the body deal with lipids, and what system does the lipids deal with? Then again, you got to realize it's this simple: kitchen, bathroom. You got to eat and you got to eliminate. Period. End of story. Sad, though, that you go to these many experts and they don't know how to fix you and tell you what to do. Sad stuff. But that's where we're at. At first I got depression, gradually stopped playing basketball and any activity I used to do because I never heard anyone else had a similar problem. Oh no, this leads into severe scoliosis, son. And felt like no one could help me and that I could never be like a normal human again. Then I searched the internet for solutions and found you. In the late 2018, I started watching your videos and slowly started changing my, this is cool. I stopped eating anything animal related, boy I would, since 2019. The problem didn't appear that much and I kind of forgot about it. 10 days ago, I started a yoga. Hello, I'm still here, even though I'm better. A yoga practice I was taught from a yoga center named Aisha. The first 5 days, I felt better than ever, more energy, happier, better voice, but somehow I damaged my spine. Yeah, take some time and regenerate your body. Keep the activity minimal, and really yoga activity is not that bad. Stretching is excellent for you and stuff like this, but you're wakening up to the problems, And so you really want to move this out. You know you can. Already you've seen improvement. Now dig in. I got the same problems again, and I think I'm going to go on a fruit. Yeah! Apples and oranges mainly. Hit the grapes sometimes too, son, because I want to get rid of my health. Absolutely. And make sure your kidneys are filtering. Go after this. I don't go on a fruit diet only for more than 10 days before because I always wanted to eat something salty after a while. Okay. So now, what did he say earlier that relates to salt and relates to what in the body? Right? So, you salt cravers, guess what's weak in you? Your adrenal glands. Oh, heck yeah. Your adrenal glands. Whoa, the adrenal glands sit where? Oh, on top of the kidneys, one on top of each one, right? Oh, you got an extra one, give it away, right? That's medical thinking, really. Hey, you got 5 fingers or 4 fingers and a thumb. Might as well give 1 or 2 away. You don't need them all, do you? I mean, it's just insanity to think stuff like that. Just insanity. And yet you put yourself out there like you're the... I am a university student on computer science. Yep. What's the radiation? Right now, I don't have any money to buy herbs. Do you think I can do it? Well, get a hold of Western and see if they have any herbs there that they can help you and donate to you. I know I used to carry a lot of herbs there that I would give. If not, let us know. I'll see if we have any donation money left here, and we will get you something out there if we can. But give me a picture of your eyes and send me your stuff here. Wanted to eat some salty. So we know immediately, and that's tied into what? Yeah, his anxieties. So anxiety, salt, adrenal glands, and then adrenal glands, kidneys, non-filtration, lymph backed up. Yeah. And then you got acids that are backing up. Well, acids are inflammatory, right? Because the body's trying to. Remember, inflammation is not a disease. It's your body's immune response. Hey, I got a problem. What do I need to do to fix it? All right, so you dilate the blood, you bring in more alkaline chemistry. What does that tell you? All right, that you have an acid agglomeration. Significant compared to the one above. I have myopia, which I managed to regress a little, but I recently spent too much time on screens, and the regression stopped there. Yeah, I mean, you got to be careful. That's all I don't know what to say. I am balding. Oh, whoa, 25 years young and you're balding. Oh, my God. So you're backed up all the way up. And you got to stop that balding. I'm 74. I think I'm doing pretty good. Man, you got to get up in there and get your head drained, man. I am balding, and I used to have hypothyroidism. Makes total sense. So then you're not sweating well either, right? Or have you picked that thyroid up and then able to sweat, but somehow managed to get rid of it without even fasting? Never know. If you read this, thank you in advance. Thank you for helping us. Oh, you got it, my friend. Love you, son. Listen, we'll help you. There's help between us, the students, Marco, Grapegate. You'll get your help. And like I say, get a hold of Western and see if they have some, because they were telling me they were going to set up some kind of, help, whatever they want to call it. But if not, let us know. My son is a health center. He has, sometimes people give donations, and so you're just the type we want to help. 25 years old and about to lose the spine and everything else. I think that's, nah.